All right, we're back for another episode of the Cut to the Chase podcast. If you've watched the previous episodes, you know how this works. I generally discuss 3 different topics, 2 minutes each. My name is Nick Pappas. I'm a board-certified orthopedic surgeon in New Orleans, Louisiana. Let's go. First topic, sunlight. So you may think it's weird for an orthopedic surgeon to be talking about sunlight, but the reality is I've seen more and more cases of vitamin D deficiency. And a lot of times it's patients who don't really go out in the sun much. And in 2 cases, it actually led to their fractures not healing. So the exposure to sunlight is actually pretty important. And I know there's concerns with skin cancer, and certainly, using protective sunscreen is very important to preventing skin cancer. At the same time, though, you still do want to get some sunlight because your body uses it to help make vitamin D in the skin. And the vitamin D helps make your bones stronger by helping you absorb calcium. So you still need to get some sunlight. And the typical recommendation is going to be around 15 minutes or so per day to help activate that vitamin D, which is key to keeping your bones strong. Now, if you can't get sun at all, you certainly can try to get vitamin D from foods. Salmon actually has a lot of vitamin D in it. And most of the milk and dairy products are fortified with vitamin D. But you still want to get sunlight because it has other benefits, especially for setting your circadian rhythm and for sleep and all that stuff. So the sun is still important. That's the time. All right, topic number 2, a general orthopedic topic, back pain. What do I do about it? So if you've made it to 40s or above, and certainly possibly even in your 20s and 30s, you've probably at some point had some back pain. It's probably the most common orthopedic complaint there is. And the question is, when do I worry about it and what do I do about it? So the majority of the time, back pain is usually a muscle issue. Sometimes you can have a bulging disc or a pinched nerve, and that would manifest in different ways. Usually a bulging disc will be more painful and will happen from a discrete injury, and a pinched nerve will cause numbness down your legs. Okay, and that numbness down your legs is a little more concerning, that something more structurally disruptive is going on, especially if a disc is herniated. But in general, most back pain is going to be muscle related. And a lot of times it will just dissipate. Now, if it's been going on for more than 3 weeks, that's what I tell people. When you have an issue that's been going on for more than 3 weeks, that's when I usually would try to seek medical attention to see if maybe something else has occurred. If there has been a disc herniation, it may not fully heal on its own. Now, even if it is a herniation, most of the time, believe it or not, it actually does heal on its own without any kind of surgery. Physical therapy can be helpful to strengthen your core muscles, and that's what therapy is for back issues. If you strengthen the back and the core muscles, it actually helps stabilize your spine to prevent issues coming up down the road, and also help those muscles that are basically spasming reset themselves. So that is the deal with back pain. If you do get it and it's been going on for more than a few weeks, I would seek medical attention. But the majority of back issues tend to be muscle related and end up not needing surgery. And that's fine. All right, last topic, alternatives to NSAIDs. So NSAIDs are nonsteroidal anti-inflammatory drugs, and they do have side effects. Even though they work quite well, they can cause stomach irritation, they can cause kidney problems. And so some of my patients come in saying, hey, my cardiologist or my primary care doctor said, no NSAIDs for you. What are the alternatives? There are a few other things out there we can use. I try to stay away from doing narcotics, at least if they haven't had a fracture or surgery. And we try to do other things that they can maybe take every day and still function without the side effects of being excessively drowsy. I do start favoring a topical in that scenario. Now, there are things like BioFreeze, which is menthol, basically just kind of cools your skin, and they're lidocaine patches, which basically just numb up the area. But the alternative I've been using more often has been a topical CBD or cannabidiol, and I've definitely seen better results with that than the other topicals. It does exert an anti-inflammatory effect, but the side effects tend to be less. It is not an NSAID. It doesn't create gastric issues like an NSAID can. And it has been effective. Now, finding the right concentration has always been difficult. Fortunately, there was a study recently that showed if you mix CBD with shea butter in a 6.2 milligrams per ml concentration and apply it twice daily, it can have a very good pain reduction in patients with arthritis, 60% reduction after 2 weeks. So that is what I've been favoring as a topical. I even had my health education company, Elevated Health Solutions, replicate that exact mixture because it was so effective in the study. And I've used it on my patients and family members and even myself, and I've seen good results. It can really decrease the swelling and the inflammation. So in terms of alternatives to NSAIDs, if you're looking for a topical, that is what I'm favoring, and that's time. All right, that concludes this episode. Hope you enjoyed it. Stay tuned for the next one. Cut to the chase!